Welcome viewers, I am Dr. J.P. Das, Principal of National Institute of Medical Science and Director of Moshumi Hospital. Today I have brought a very important topic, how to visualize the spleen by sonography. So you please view this thing. I think the doctors would be benefited, doctors and technicians would be benefited from this. So without delaying, I am starting the video. Today we shall teach how to visualize the spleen in the ultrasound. We shall learn for visualization of spleen. So where spleen lies, this is spleen, this is spleen, okay? The spleen lies in left upper quadrant of the abdomen, here it lies, and close contact with the diaphragm. See, here is the diaphragm and it is in the close contact and completely covered by the ribs. See the ribs overlying the spleen, and here is the spleen. The left kidney lies caudal to it. Here the left kidney. See, this is the outlines of the left kidney. And stomach lies anterior to the spleen. Here is the stomach. So spleen, it is the largest lymphoid mass in the body. It has many semilunar-like shape, semilunar, like the crescent, having a cleft on the medial side. See, here is a cleft in the medial side, which is called the hilum. And through this cleft, the vessel passes, blood vessel passes. The anteromedial margins, several notches are there. You will say several notches. And weight of the spleen is around 300 grams. And average it is 12 centimeter long. If you measure from here to here, average measurement is 12 centimeter long. Spleen is interperitoneal. It remains under the interperitoneal, whereas pancreas is retroperitoneal. Pancreas remains behind the peritoneum, and spleen remains inside the peritoneum. Now come to the ultrasound anatomy. Spleen has a homogeneous fine ecostructure. This is spleen. See, homogeneous fine ecostructure, and it is equal or less than the liver ecogenicity. And the overlying rib cage, anaerobic, colonic and fundus gas sometimes possesses problem in visualizing spleen. So these are the problems you have to overcome. Now come to the scanning technique. How we'll scan? Overnight fast, it is not must. It is not needed. But if the patient do fasting, there will be less gas in the abdomen. So you can view clearer picture. And overnight and fasting will provide a good window for the ultrasound beam to penetrate. If there is air in the stomach, then spleen cannot be visualized in supine position. So the position of the patient should be maintained light lateral decubitus position. This position, right lateral decubitus position. See, spleen in the up, liver in the lower side. So you can visualize the spleen. That is right side on the up and left side in the lower side. The best scanning you can perform at 10th, in between 10th and 11th ribs. In here, 10th and 11th ribs, you can see the spleen properly by intercostal space in between two bones. In slight obliquity, it should be slightly oblique. If you tell the patient to take deep inspiration, then the lungs will come over the spleen and you cannot see. You can tell the patient half breath. So lung will push the spleen little down but will not overlap. Elevation of the left arm. If the patient elevate the left arms, the ribs should be diverted. So more space would be there and your probe will get more space to send the beams and you can see the spleen more clearly and the transducer head will get more space. The rule of the thumb is spleen or left kidney is visible by putting transducer on the subcostal area and if there is splenomegaly is suspected. Splenomegaly can be detected clinically by putting your hands over the abdomen. Very easily you can detect it. You have to start palpating from below the umbilicus. In Harrison it is clearly written. You have to start palpating from right space below the umbilical. Spleen is capable of growing enormously, extending inferiorly into left iliac fossa. It can go up to left iliac fossa. Sorry, I have done mistake. Means Harrison it is you have to start from the from the left iliac fossa. What are the common causes of splenomegaly? Common causes of splenomegaly, number 1 is malaria, number 2 Kala-Azar, number 3 polycythemia, number 4 metastasis of cancer from different parts of the body. Now, tumors of the spleen. There are two types of tumor of the spleen. One is benign, another is malignant. Primary tumors are very rare in spleen. Benign tumors are hematomas, cavernous hemangioma, and cystic lymphangioma. Malignant primary are common hemangiosarcoma. In one such primary, which ultrasound gives mixed cystic appearance, resembling cavernous hemangioma. Now, the splenic metastasis. Splenic metastases are generally multiple and they are hypoechoic, but here you are seeing it is echogenic. Maybe echogenic, like here. Here it is echogenic. And sometimes it is mixed, hypoechoic and echogenic, mixed. Usually, metastases area are malignant melanoma, lymphoma, leukemia. But carcinoma of the ovary, stomach, or breast may also cause metastasis in spleen. Hemangioma may have a well-defined echogenic appearance. It is hemangioma. It is. Ultrasound is diagnostic subcapsular, pericapsular hematomas of spleen. Due to trauma, look at this picture. You are seeing the hypoechoic area. This is hematoma. Due to trauma, if the capsule remains intact, the outcome may be intraparenchymal. See here, it is intraparenchymal or subcapsular hematomas. If hematoma is fresh, it would be echogenic. With the course of time, echogenicity will go down, 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 because the blood will be transformed. Blood will clot, color of the blood will be transformed. So there will be echogenicity would be less. If hematoma is old, you will get a hypoechoic area. But if it is fresh, then the same thing would be echogenic. But if the capsule ruptures, a focal or free interperitoneal hematoma may result in demonstrating fluids surrounding the spleen, because the blood will come out, it will surround the spleen, and you will get blood outside the spleen. What will be look like? Hematomas, fresh is echogenic, and when it is old, hypoechoic. Mostly, the fluid is walled off in the left quadrant. The size should not be more than inferiorly 12 centimeter. Inferiorly. Here you have to measure from here to here. It would be around 12 centimeter. And anteroposteriorly, it would be in between 8 centimeter, and hilum upward is 4 centimeter. The formula, children's formula, 5.7 into in bracket 3.1 into age of the years. By this formula, you can calculate the spleen volume. Now come to the splenomegaly. Why splenomegaly occurs? It is due to malaria, maybe due to dengue, enteric fever, hepatitis, tuberculosis, and heart failure, and portal hypertension, lipoma, chronic leukopenia. Now, another very mysterious thing you will see here. Look at this picture. Here is some splenic tissue. This is spleen. Outside of the spleen, there is some splenic tissue. you can see this thing in 10% of the cases. And it is a round, oval mass commonly near hilum. Structure similar to the solitary, similar to the spleen. It may be solitary or may be multiple. Now come to the splenic marches. First is see this picture. What you see in this picture? Lots of cysts, hypoechoic area, world. So these are all cysts. But congenitally it is rare. It occurs after birth. And it is due to old trauma. And maybe hemorrhagic cyst. Previously there was hemorrhage. After that cyst is formed. And maybe due to hematoma. Maybe due to abscess. Abscess is converted into cyst. Maybe metastatic. And maybe due to pseudo-aneurysm of splenic artery. See this picture. What you are looking? Multiple bright spots. It is commonly due to tuberculosis. When there is tuberculosis, you will get such bright spots. And there may be triangular, hypoechoic, solid areas based commonly around periphery, apex pointing the hilum. These are maybe due to emboli in the IV drug users. When the drug users use the drugs IV, then this type of thing occurs. And when there is thrombosis of the vessel and pancreatic leukemia and lipoma. See what you can see this picture. It is a metastasis. It is a solid metastasis. And this is uncommon due to comparatively with the liver. And commonest is the melanoma. Now come to the splenic abscess. Commonly, splenic abscess occurs of the IV drug users when there is immunity is compromised and the patient of the pulmonary tuberculosis and bacterial endocarditis. It may occur in septicemia, it may occur in trauma, infarction, air with dirty and complex fluid would be there. This is splenic abscess. What you see in this picture, hypoechoic area. This is hydid cyst. It happens when there is cattle, domestic cattle in the house, and from the sheep and dog it may come. What you see in this picture? See hypoechoic area in the spleen, but the capsule is intact. This is splenic trauma. This is subcapsular hematoma with when the capsule will be ruptured, there will be subcapsular hematoma like this. And and there may be free interperitoneal hematoma. Here it came out. The blood came out outside. So what would be the sonographical appearance? Early hematoma has a irregular echogenic march. Focal in spleen, appearance the spleen. As the time will progress, I told earlier, the echogenicity will go down, will be less. It starts to become less echogenic, darker, and darker. And you have to go to take history. You have to take history. And by investigation, you will confirm the thing. What you see in this picture, this type of picture may be seen in normal person also, especially in the old man. It is due to excessive fibrosis and infarction, as in sickle cell anemia, may also lead to the atrophy of the spleen. Atrophy, the spleen may be so small that it is hardly recognized. It will be difficult to recognize it. See in this picture, it is very difficult to recognize that it is a spleen. This condition is referred to as autosplenectomy. Now, wandering spleen. It is a spleen when you will see the spleen in ectopic position. It may be seen in the abdomen, in the pelvis, but it is spleen. The patient here may have intermittent pain and also discomfort. See, here is the urinary bladder. Besides this, there is spleen. When you will see the splenic tissue beside urinary bladder, you have to think, what is this? This ectopic spleen. Here is echogenic brighter areas. It is splenic hemangioma. What is this? What you are looking here? Lots of cyst, full of cyst, small cyst all over the spleen. These are having the history of cattle and dogs and sheep in the house. And you can see this type of picture in liver also. Now the solid metastasis. It is uncommon like liver. Melanoma is the commonest of the solid metastasis. It is enlarged left lobe of the liver, may extend over the spleen and overlap it. It should not be confused with the pathology. When the liver will come over the spleen, almost the splenic tissue and liver tissue is almost same. You should not be confused. Okay, you have to do deep study to find out as the liver has come over it or not. What you see in this picture, this type of thing you get after trauma. The splenic tissue is implanted over the retroperitoneal surface. The splenic tissue came in the retroperitoneal surface, and it may develop vascularization and thus show flow on the droplet. If you see put the color over, you will see fluke. So friends, we have come at the end of this class. Hope you have understood how to visualize spleen and different diseases of the spleen. So see you again in the next class. I shall continue this type of teaching. Hope my students will be benefited from that. Until meeting next class, bye bye. Friends, we have come at the end of this video. Hope you have liked it. If you have liked it, please give a like. If you are new in this channel, please subscribe this thing, and I shall continue this type of teaching. Please follow this thing, and if you subscribe this as early as the class will come, you will get notification, and share this thing with your friends, and see you again in the next video. Until then, bye bye.